much. Good afternoon, everyone. We'll call the Public Safety Committee meeting to order November 10th, 2020. And Madam Clerk, if we can have the roll call and posting of the agenda, please.
Member Lopez.
Here.
Member Ramirez.
I'm here.
Chair McDonald.
Here.
We have a quorum, and the agenda for this meeting was posted in the City Hall kiosk on Tuesday, November 3rd.
Thank you. And Member Lopez, if you would lead us in the Pledge of Allegiance, please, or the flag salute.
All right. If you can join us, please place your right hand over your heart. And if you can stand, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. We'll move to section B, public comments and items not on the agenda. Madam Clerk, I don't have any public comments other than the one for the agendized items. Are there no speakers in this area?
That's correct.
Okay, thank you very much. We'll move to the consent agenda. Approval of the minutes from the October 27th meeting. Has everyone had a chance to read them? And are there any changes, corrections, additions?
I'll move approval.
I'll second.
Okay, Madam Clerk, we have a motion by Member Lopez and a second by Mayor Pro Tem. Roll call, please.
Member Lopez.
Yes.
Member Ramirez.
Yes.
Chair McDonald.
Yes.
The motion carries 3-0.
Okay, that item carries. Thank you so much. We'll move to item D1, Fire Department. Subject is ambulance service feasibility studies. And I'm presuming the chief is going to do this. Chief, it's your game.
Yes, I do. Thank you. Chair McDonald and committee members, thank you. Appreciate the time again today. And before I start, if I could just offer congratulations to all three of you on your various electoral wins of last week. Yes, last week. Congratulations. Okay, so let's get into the presentation. So. First, just a little bit of background. As you probably recall, we provided a presentation to this committee back on October 13th, talking about some of the shortcomings of the current ambulance contract and ambulance provider. And ultimately, this represents 50 years of ambulance service with little to no innovation, and this service is not being provided in the best interest of our residents, and has much more to do with private company profits. And so the draft report that is being presented today was looking at two basic objectives. Can Oxnard enhance service to our residents compared with the current service? And can it be done in a sustainable way? So AP Trident was a consulting firm that was retained to provide this feasibility study. AP Trident is a subject matter experts across the nation when it comes to EMS service delivery, particularly here in California. They created the first ground emergency medical transport program, working closely with the Center for Medicare and Medicaid. This is essentially something of a first responder fee for public entities that are providing ground transport and billing for those services. They're currently working right now with the state and federal governments to develop a replacement to that ground emergency medical transport and quality assurance fee. And this is based on legislation that was passed earlier this year, which is known as AB 1705. And it's referenced in the report, but that is a new reimbursement mechanism that is currently in development and should be going into effect January of 2022. So for this study, there was three elements that we wanted to focus on: system enhancement, local reinvestment, and system sustainability. And so when we talk about control and accountability issues, these are things that were highlighted from the presentation we gave back in October. But ultimately, having local control and being accountable for the services that we deliver to our residents would provide a better service. Just to give you an example, at the beginning of this pandemic, the ambulance companies actually cut unit hours, cut ambulance resources by 30%. And that's the beginning of a pandemic. The greatest, or one of the clearest ways to illustrate the effect that this had was on the 4th of July weekend. We had a heat wave that weekend. I believe restrictions were being loosened. People were being allowed out. The ambulance company didn't add additional resources. They had kept their low number of resources. Ultimately, it turned into a busy weekend, and the ambulance company was forced to bring ambulance in from other counties. They had to bring in ambulances from Kern and Santa Barbara County to handle the call volume. And so that gives you some insight into those decisions. So right now, the ambulance company provides 4.5 ambulances, meaning 4 24-hour ambulances and 1 12-hour ambulance. And that is to a geographical region known as an Exclusive Operating Area 6, or EOA 6. And so that area includes not only Oxnard, but El Rio, Port Hueneme, some unincorporated areas of Ventura County, and PCH all the way down to the LA County line. So it's the EOA 6 is a large area. Additionally, these same 4.5 ambulances, excuse me, these same 4.5 ambulances are also used for intra-facility transfers, also again abbreviated to IFTs. But these transfers essentially are non-emergency transports. And so these ambulances are taken out of service for 911 response, and they're used to move non-urgent patients between medical facilities. Now, that may bring to mind moving a patient from, say, St. John's to VCMC or vice versa. This can often mean moving a patient from St. John's to somewhere in Bakersfield, for example, would not be uncommon. And so these ambulances can sometimes be removed from 911 service to take these transports on and be gone for hours and hours. It's also important to highlight that now that American Medical Response / Gold Coast Ambulance, it's essentially one company now, they actually have control over 6 of the 7 exclusive operating areas here in the county. And so they will often move ambulances around the West County. So these same 4.5 ambulances, it's not uncommon to find them responding to incidents in Thousand Oaks or Newbury Park. So we often have a lot less than those ambulances. In fact, when I was putting these notes together yesterday, I actually looked at the ambulance status, the resource status page that we have, and 3 of the 4.5 ambulances were in areas outside of Oxnard when I looked yesterday. My apologies, I didn't actually look before we started this presentation today. But ultimately, if we were to change directions in the way we provide ambulance transport, we could still provide mutual or automatic aid to these outside areas, as we do with fire resources right now. But these resources would primarily be dedicated to Oxnard to provide adequate coverage at all times. And so what the AP Trident report showed, or the draft report shows, that having 4 24-hour ambulances, along with some surge units, 1 to 2 12-hour ambulances to use as surge units when it's busy, would actually be adequate coverage for the city of Oxnard. And so, because they wouldn't be doing all these other auxiliary responsibilities and going to other areas. 4 24-hour ambulances and 1 to 2 12-hour ambulances would be adequate for our residents. So one of the biggest things that we wanted to focus on with this change is being able to improve healthcare equity. So what does that mean? Well, first, if I can talk about the mobile intensive care and community paramedicine box that's up there, we can better serve those with low healthcare literacy. And generally what we mean by that is referring to people with no primary care physician. We can provide much greater support for hospice patients and their families, and really act as an intermediary to spot issues or gaps in care. It would improve patient experience and ultimately reduce readmissions to hospital. Another piece of legislation I just wanted to touch on briefly when it comes to community paramedicine is legislation that was recently passed. It's known as AB 1544. It was for community paramedicine projects and alternate destinations. And the state recognized that for community paramedicine projects, these are very unique programs. And the state recognized that the fact that they are unique, they gave public agencies the first right of refusal to implement and run these programs because there's no profit margin for the private companies. And just since we've become an agency providing paramedic services, we have started providing community-based projects. Our antibody testing regime is just one example of that. Another fantastic opportunity with AB 1544 is the alternate destination piece of that legislation. So currently, as it stands, anytime that we go on somebody, anytime we respond to somebody with a behavioral health issue or a substance abuse issue, really all we can do is take them to the ER. We don't have another choice. But ultimately, someone with a behavioral health issue or somebody with substance abuse substance abuse issues, an ER generally is not what they need. And so this ability to provide an alternate destinations, we can actually take them to a substance abuse center, take them to a behavioral health hospital so that they can get the help that they actually need, rather than first having to go through an ER visit before they then get to go to these alternate destinations. So that's just another example of where we can innovate how we take care of our residents here in Oxnard. We're currently working to establish other community-based programs and projects, and so there'll be more to follow with that. The second part of this slide that I wanted to touch on was telemedicine. And I'm sure all of you are very well aware of telemedicine because since the pandemic, every doctor's office and most medical facilities are now offering telemedicine as an option. However, when we talk about telemedicine, we're talking about this at the point of dispatch. And so we've built this program, but it has not yet been implemented. And we built this in response to COVID-19. If there was actually an enormous surge in cases, which thankfully we have not seen yet, we would have the ability to provide care to patients without actually having to transport them to the ER. So this telemedicine program is essentially at the point of dispatch, meaning that on these lower acuity calls, our fire personnel would respond to the residents and then be able to provide, be able to check their vital signs and then be able to provide a face-to-face meeting with a doctor, a telemedicine consult, essentially. That doctor would be able to prescribe medications, and it's not tied to whether you're in network or out of network or have insurance. And so we essentially would be able to provide a much higher level of care from the comfort of their own home. They would not have to be transported to the ER. Obviously, there are absolutely cases where people have acute medical issues that they must be transported. This would be for lower level calls. And certainly in the world of a pandemic, keeping people out of ERs that don't have to be there only reduce risks for our residents as well. This telemedicine program would have a cost recovery component to it, as well as obviously a compassionate billing policy component. And this kind of telemedicine program wouldn't be possible with a private ambulance company because the private ambulance company business model is built on transportation, on moving patients. And indeed, when we first developed this idea, our local EMS agency was very concerned about ambulance company profits if we were going to implement this telemedicine program. And so again, this program is based on community need and not on profit. Another system enhancement that we could make is the first responder advanced life support services, which is kind of a mouthful, and the acronym doesn't really work as well as some of our three-letter acronyms. But what this would allow us to do is work towards a goal of having a paramedic on scene within 4.5 minutes as often as possible. Every study on pre-hospital care, when you talk about response times, that every study shows that a response under 5 minutes for a paramedic to arrive on scene improves outcomes, and that's regardless of where the destination hospital is. Private ambulance companies won't do this. They can't do this because that's their profit. To have that many vehicles on the road to reduce response times that much would essentially be their profit. So the other part about improving our, creating more system enhancement is also some of the life-saving equipment that we'd purchase. One great example right now, particularly in the middle of this pandemic, is mechanical CPR devices. One of the issues that our responders have right now, because we now live and function in a world of COVID, whenever CPR is one of the highest risk procedures that we can do in terms of potentially being exposed to COVID. And so all our personnel now have additional PPE on, and they have a big mask on, they have their goggles, their gloves. What ends up happening is they'll often stay on scene doing CPR for anywhere up to 40 minutes. They become very sweaty, very swampy, mask starts moving around. This is where we've had PPE breaches when our personnel have been on these calls. So a solution to that is a mechanical CPR device. Getting money for those CPR devices has been a challenge that we're continuing to work through, but that would be one example of equipment that we could purchase as a reinvestment to keep our personnel safe and arguably improve the outcome of our patients because that CPR device will give the same quality compression regardless of how we're moving the patient as we're getting them in and out of the ambulance and that kind of thing. So another example of an innovation that's been made recently is the LA County Fire Department has actually started a stroke unit ambulance. And so it's an ambulance that has a doctor, a physician's assistant, and a paramedic on board. And they respond to certain calls that appear to be stroke calls to begin treatment immediately. One of the most critical elements in a stroke patient is being able to get the drugs on board that dissolve the blockages in people's brains. And so that's just another example. And so while I'm not normally one to read off slides, this quote out of the draft AP Trident report I think is really important to highlight. And it states, "The interesting aspect of this arrangement is that when the provider is not in compliance with the service requirements, such as delayed response, the ambulance provider is fined. These monies are then paid to the county and not the city, although it was the city that experienced a compromise in service they deserve." I think that's a very poignant statement. So another thing that the draft report highlighted was the difference in unit hour costs between what the Oxnard Fire Department could provide and what the private entity is providing. And what I really want to highlight here is that we have the opportunity to provide meaningful jobs for local residents that will pay more than the current providers and still be a much lower cost than AMR's cost of $274 per unit hour. And so this would also help us with local recruitment and potentially be a feeder program for fire department personnel. But it would also be a career opportunity for local residents that are interested in becoming paramedics or EMTs and working on an ambulance. Maybe they don't want to become a firefighter. And the other part about this slide that I want to highlight is the unit costs that are represented there for Oxnard Fire ambulances of $140 an hour. That price was based on firefighter paramedic staffing. What we've asked the consultant to do is look at the cost of providing the Oxnard Fire ambulance service with single function paramedics and EMTs, meaning that they would not work on a fire engine or a fire apparatus. They would only work on an ambulance because, as the name suggests, they're single function paramedics and EMTs. And I just want to let the committee know that currently AMR ambulance pays EMTs in this county $13 an hour. Paramedics get paid $15.96 an hour. That's their current wage to provide life-saving services in this city. So one of the things that we did want to touch on is this AP Trident draft study shows that the system can be self-sustaining. We used, the consultant used conservative reimbursement rates that have been vetted. They actually used an estimated reimbursement $200 below the state average to determine their numbers. And one of the other things that we've asked the consultant to provide is more information on that intra-facility transfer part of ambulance transport and those non-emergency transfers. We believe there is potential for us to partner potentially with St. John's Hospital to be able to provide those transfers using our personnel and ambulances at a lower cost than what is currently being charged. And so that's going to need a little bit more vetting, and we're still looking into that, but there is potential there for additional benefits to our residents. And so as you would have seen in that draft report, that Oxnard does have a favorable payer mix due to the different demographics there. And so one of the breakdown between Medicare, Medi-Cal, commercial insurance, which is having your own medical insurance, and then a relatively low level of private pay, which is generally the uninsured. And so that gives us a mix that provides for a much more sustainable system. And so as you can see over this slide, and then I guess more importantly this slide, having these prices are based on having 4 ambulances, and based on our current call volume, is that the transport revenue would be just over $7.3 million to have 4 ambulances. Remember, they're 4 ambulances staffed by firefighter paramedics, would cost about $4.6 million. And then ultimately we'd have $2.7 million to reinvest in the system for having those surge units, surge ambulances, and also having more firefighter paramedics squads to respond to calls, again, with our goal of trying to get to every one of those code 3 responses having a medic on scene with 4.5 minutes. And so with that, I am open to questions.
Any clarification questions for the chief at this point? If not, Madam Clerk, if we can get the one request to speak on this on the line, and we'll go forward with that.
Okay.
And for the rest of the committee, the speaker will be Mr. Ray Blattel.
Got it.
No, we do.
Hi,
Hello?
Ray. About 3 minutes for the ambulance item. Please begin now.
Thank you very much. Chair and committee members, for the October 13th Public Works Committee meeting, Phase 1 of the AP Triton effort is a feasibility study, and the scope of the work required the vendor to conduct cost/revenue analysis of various options available for OFD, including the following methods of delivery. A, OFD providing ambulance transport by contracting through one or more private suppliers. B, partnership, that is shared services between OFD and private and/or public ambulance suppliers. And under this are their 4 sub-elements. And C, OFD providing 100% of the ambulance service. Additionally, according to the statement of work, the vendor was to work in conjunction with the OFD staff to develop a recommended path forward. Well, reading through the entire report, I didn't see where all 7 of the mentioned delivery options were fully explored. What was explored was the existing delivery method and quickly transitioned to how OFD can provide the service at a 100% level. The study clearly says there are more than one option, each with advantages and disadvantages. However, the study quickly focuses on and drives to the OFD solution. To me, it looks like the conclusion has already been made for an Oxnard Fire Department takeover, but maybe this has something to do with OFD staff coaching. And per the same October 13 OFD report, With the deployment of the Squad 68 in conjunction with the current provider, it was stated that the response times were reduced and the service to the South Oxnard area and underserved were vastly improved. If the response time and service deficiencies were addressed by the addition of the ALS team, why the need for a change? Plus, Oxnard's ALS team is already covered by the OFD budgets and wouldn't cost the taxpayers any more money like the current proposal. Now consider the cost data in the study. The study says for 2019, Oxnard required 12,517 transports for Gold Coast, where the cost payback was $7,314,537. Then the study says it would cost $4,613,009 for an OFD supply service with a net recovery cost of about $2.7 million. But Proposition 218 says the government cannot charge more for a service than it actually costs to provide this service. So if the total operating cost for a 100% OFD provided service is $4,613,009, then this is the amount you can charge and no more. So where do you see a net recovery cost reimbursement?
30 seconds.
Reinvestment. And speaking of costs, in the spirit of full transparency, shouldn't the $72,000 fee per year for 3 years to AP Triton be disclosed and folded into the OFD cost data if OFD is the selected supplier? This little amenity is in an italic print at the bottom of page 10 of the scope of services. Is this fee, which per year value is actually more than the study's phase 1 cost, a little more incentive for AP Triton to arrive at a predetermined conclusion in favor of OFD? I'm just thinking, and you should too. It kind of smells funny to me. Thank you very much.
Okay, thank you to the speaker. Do the committee members have any comments?
I do.
Mayor Pro Tem?
Thank you, and I appreciate your indulgence. I'm traveling at this moment, but I've been listening very intently, and I do have some questions for the chief. And that would be, Chief Hamilton, thank you for the study. It seems to me, actually, I was quite surprised at the amount of pay that the paramedics and the other folks were getting at almost living wage, sort of living wage for, I mean, could you comment on that?
You're absolutely correct. The those wages, that's what the current contract is for AMR Gold Coast paramedics. $13 an hour is literally minimum wage, and so it's difficult to make ends meet at that level. And again, what's interesting is the AMR's unit hour cost is literally double what the estimate would be for Oxnard Fire to take over or to provide the same level of service. Yet our numbers were based on what we currently pay our firefighter paramedics, which is not minimum wage.
Disturbing to ask people to do some of the most important work and pay so little. I would like to ask you to I know you're going to respond to Mr. Botel's questions, I hope, but I would like to ask you to be, from the devil's advocate point of view, what would be a legitimate objection to our city going this route that is being recommended to us?
I think the objections would probably come from the county EMS agency, because essentially we're asking for the council to provide direction on asserting local control over the city of Oxnard. But as I mentioned in the presentation, Oxnard is a part of a larger exclusive operating area, and so it would essentially change the way the county provides ambulance services. Likely around the county, they would have to make some adjustments if we were just going to provide ambulance service for Oxnard. But again, obviously, we can set up mutual and automatic aid agreements to help our surrounding jurisdictions. But that would probably be the single biggest objection. I guess notwithstanding the ambulance companies who enjoy making a considerable amount of money right now in the city of Oxnard.
Could you address Mr. Botel's issues? briefly, if you could.
Absolutely. I'll do the best I can. The first misconception I'd like to correct for Mr. Botel is he mentions taxpayer money. None of what we're talking about would be funded by taxpayer money, other than obviously the cost of the consultant themselves. But all of this this essentially is it's funded by the people that are using the service, and so the people that use the service pay for that service, obviously within the context of a compassionate billing policy, and so but this would not touch the general fund at all. It would all be, and that's what we talk about when we talk about self-sustaining. Right. Another one of Mr. Botel's points was starting our ALS service, improved response times, so that should be good enough. My apologies, I'm paraphrasing a little bit, but opening our paramedic squad in the south end of town improved response times to the south end of town. Obviously, that is not the entire city. And what we actually found in response was the ambulance company then moved ambulances further away from that area and further north. And so all it did, and this is what will often happen, is the ambulance company is looking for, they're a private business. They're looking for the ways to make money. So if they can move their ambulances closer to the next call, that's what they're going to do. Or if they can move their ambulances across the Camarilla or something like that, that is what they're going to do to make additional money. So it's not as simple as saying, well, we started one paramedic squad and all our problems are solved. As I tried to articulate within this presentation, the reinvestment is all about trying to get to.
I should be done in about 15 minutes. I'm sorry.
Trying to get to our residents just as quickly as possible, because that's what's going to provide the best outcomes for our residents. The issue that he highlighted with Proposition 218, I'm not familiar with that. However, we're not the first fire department that has looked at doing this in California. So I'm going to have to come back to the committee with an answer on the Prop 218 issue. I think I addressed the majority of.
Thank you very much. I would support the recommendation, because first duty of our city or any government is to protect the citizens and the residents, and it seems like this is the appropriate way to go. Thank you.
Member Lopez, do you have any comments?
Yes, thank you. Thank you. This is very valuable information, and I appreciate the questions and the comments from Mr. Botel to kind of expand on the information. The question I have is in terms of, and you kind of mentioned that this would not be, it would not touch the general fund, but in terms of the setup and the initial organizing of it, what would that look like in terms of cost, and is that where we might expect anything to come from the city? If there's any information that you can provide at this time. And thank you, Chief, for the presentation.
Absolutely, and that's a great question. So I think, and this sort of ties in to one of Mr. Botel's questions. Right now, what we're asking is for this presentation to move to the full council, and then council to provide direction on the city asserting control over the ambulance transportation contract. And so at that point, we will then have some time to develop options, which I think is what Mr. Botel was alluding to in terms of how we wanted to implement that system. But let's just say, for argument's sake, we're going to implement a purely 100% Oxnard Fire Department system with our own ambulances, our own personnel. There would be some amount of seed money cost that we would need to, and what that looks like remains to be seen, but we would need some amount of money to begin the program. However, whatever money was needed would obviously be paid back with the revenues from implementing our new system. So that would be something that we would be bringing back to council as we flesh out what we want our system to look like. Great,
thank you. And with that, Chair McDonald, if I would be happy to make the recommendation to send this to the rest of the council.
Okay, I'm just going to make a
Second
couple of
that.
comments real quick, but we do have a motion in a second. I'll finish my comments fairly rapidly. First off, I'm not fully sure that Prop 218 would apply to this particular circumstance, but even if it does, this is not about trying to make a profit off of our community. This is about providing important, potentially life-saving service to our community. And there are some reimbursements coming already, and the reimbursements that should come to the city are going to the county because the county operates the system. This is a statement I've made before. I'll make it again, that Oxnard is 1/4 of the county's population. And my understanding is that we are one of the largest groups that gets transported to VCMC for trauma care. And I still don't understand why St. John's was not selected as a trauma center. It should be a trauma center. I think it's much closer to transportation routes than other trauma centers, but it should be servicing our community, and it's not. And I find that unconscionable. I don't like the idea. I don't like the idea that the more seriously you're injured, especially in the distant parts of our community, the farther you have to go for that treatment, when there's a very fine, reputable hospital here in our city, and we're not allowed to use it. This is not about nickels and dimes in my book. This is about protecting our community, providing excellent service. And I think it is very worthwhile. And I don't usually say things like this, but I have to say that I'm just a bit offended by the inference that we're just blindly going down this road, that none of us read anything, none of us consider anything, and none of us give this any thought other than just to accept what the fire department has said. And that is not a true statement, period, end of discussion. I have read this material. I'm quite confident that my peers have read this material. And I'm also quite confident when this goes to council, that the entire council will read this material. So I'm just, well, I'll just stop at this point and say that I support this recommendation. I support it moving forward. Again, it's not about nickels and dimes. It's about providing potentially life-saving response and services to our community, which is challenged right now. So with that, Madam Clerk, we have a motion and a second. If I could have a roll call vote, please.
Member Lopez,
Yes.
Member Ramirez,
Yes.
Chair McDonald.
Yes,
The motion carries 3-0.
thank you very much. This item will move forward to council as requested. That takes us to item E, items for future agendas. Do either member have any future agenda items they'd like to request?
I do not. Thank you.
Not on my end. Thank you.
All right, thank you. I have none. With that, we will move to adjournment. This meeting will be adjourned. Thank you all for your participation.
Thank you. Bye-bye. Thanks.
Thank you.
Thank you.